do you feel about hearing that there's a certain percentage of women who refuse to get screened?
Well, everything that I do is about, educating young people about getting to know their breasts at a younger age, because obviously screening doesn't happen until you're 50. So, and thousands of breast cancers happen before that age. So it's down to us as women to get to know our boobs and notice if something's if something's changing.
Yeah.
If there's any abnormalities, then we should go get them checked out. And so that's, so by the time you hit the a higher risk age category of 50, or when you're asked to go for screening, you should already know your breast. So, and even, that's every 3 years. So in that time, breast cancer can happen too. And so you can't just solely rely on screening anyway. But it's a personal choice. And if people don't want to go, that's fine. But you have to make an informed choice and not just ignore the letters.
They are saying that there is increased risk of radiation and things happening from the mammogram. What do you think about younger people electing themselves to have mammograms earlier than the recommended age?
The reason young women don't get screened with mammograms is because our breast tissues are too dense. So, I had a 9 by 6 centimetre tumour in my breast when I was diagnosed. And I had all the tests, not immediately, and unfortunately it was diagnosed really late. I had a biopsy, I had an ultrasound, I had a mammogram. And they obviously, women, ladies who've had mammograms, you know what it's like. It's not the most pleasant experience.
It's horrible.
Imagine squashing your boob with a 9 by 6 centimetre tumour inside. So obviously it wasn't pleasant, but in fact, that's not the thing that eventually picked it up. It was everything else. So, that's why young women don't get screened, and also the risk is obviously not as high when you're younger, but it's not impossible. It's about education and learning and knowing what's right for you.
I couldn't agree more. Sorry, Colleen. I couldn't agree more, because I didn't start having... I paid to have mammograms privately because they weren't available on the National Health from the age of 40. But then I discovered exactly what you've said, that the mammogram alone doesn't work. You have to have the ultrasound scan as well, because that's the only thing that will pick up if you've got really dense tissue.
Yeah, and obviously they can't just go complete by mammograms, then you'll most likely have a biopsy, like you see in the C word as well.
Yeah.
And that's when they'll know what kind of breast cancer is, because there's different types. And obviously in this article they talk about DCIS. That's a very slow-growing and early-stage breast cancer. But there's so many different types of breast cancer, and a lot of people don't realise that. A lot of people just think, okay, well, I've heard this, it's going to cause me more damage than good.
Which is
I'm
what
not
I
going
heard,
to go.
Which is what I heard, because I was having them quite regularly.
And since the screening of the C word, obviously so many people were talking about it. We were talking about it just as women ourselves when we came in today. And obviously Colleen brought up, because of your family history and the amount of tests that you've had done, obviously there's research out there showing that it can, in some rare cases, some experts are saying that it can cause more harm than good. Because of the programme, I was thinking, I think I'm going to go and get myself... I checked myself after the show and thought maybe I should pay and go and have a mammogram. I'm like many women out there, I'm confused now. I don't know what the best thing is to do.
I would say don't panic yourself into going to get screened.
Okay.
Get to know what's right for you. And I'm so glad that you said that you check your boobs straight after. So many people said that.
Yeah.
And it's about knowing what's normal for you and actually having a good relationship with their boobs. The work that I do with my charity is unbelievable. We're even facing a problem where women don't even touch their breasts. And how will we ever know what's right? And you can't completely rely on your GP to notice something, or you can't just rely on mammograms. It's about general awareness. I believe in knowledge is power, because I didn't know I could get breast cancer at 23. I didn't know I should be checking my breasts. That led to a secondary diagnosis, and I will always have breast cancer. And that is so frustrating. So I'm all about knowledge is power.